يعني هنا ejection fraction شاب massive polyps ejection fraction 30%.
أنا اشتغلت حالة
Why? Because the nose is a good relationship with the medial ear through the Eustachian tube. Look some images about the rhinopharynx. Then the difficulty that you met in different situations, fluorosis, catarrhs, and then this closes the ear, the medial ear, meaning that if the nose not work well, also the ear have the
الصلعة
Other suggestion, always the nose is important for the growth of the maxillary area, because if you have the mouth and not breathing well through the nose, you have the big problems. And also the bad breathing through the nose arrived to inflammatory pharyngitis and also problem in the medial ear. Why the surgery in the nose? Because we have different causes of deformity. The first, the birth trauma. This give a trauma in the nose or the passage in the growth channel, and then you have the problem. The first steps when the children started to strengthen with the possibility to do trauma in the nose, and also the place that go down in the face. And when ENT met a person like this, child like this, which solution, which therapy? In the time you know well that this is very difficult to understand this surgery in the children. And the proposal many people to start the surgery after 80 years. And the question are, which type of surgery, which type, and also which resource. And the suggestion is to use the non-destructive technique in the nose in children, but the functional surgery technique. The age, in my opinion, is no problem. I started the children's surgery nose at 5 to 6 years. When you have the very important deformity in the nose, non-aesthetic deformity. I always make the analysis before surgery. Why? Because this helped me also for the strategy in the surgery. I use the Cuttle technique for the surgery of the septum, and I will show some clinical cases. First of all, these children without sorry, I know you see anything, and then it's better to me, okay? And look, not have any this deformity, but the problem is staying inside here, the bulb area closed here. And then I make the surgery with the epitrus fissure incision started here in the right part, raising the anterior tunnel in the left, and finish the anterior tunnel. This is the name is the magic plane I made, because open a plane in front of the nasal spine for to arrive the ear in this part for to go inside to the nasal cavity. In both parts, the incision under the nasal, the septum, the nasal spine here, the periosteum for to arrive in this area, and you met the piriform crest here, and with this elevator you move a little bit the mucosa, because when you remove the septum you cut. If before you open this area, no have any problem. find the incision here, and I remove a deviation of the piece of the septum in this case. I soft picking the tunnel, intracolumnar tunnel, and I introduce the piece inside, but in this moment it's straight. And the suture. Finally, this is the same, no have any change here. But the change here, sorry. You see well here, but you see better now. The valve area blocked in the right part, and now it's open. This is a good news now. The functional analysis before with the rhinomanometry is closed in the right part, and after surgery, and the acoustic rhinometry also before and after surgery. This case is a child of 7 years, he had before the traumas, and look the irregularity here, the asymmetry to the columella here, and the valve closed here. And the alteration for the maxilla area. The functional analysis before surgery, rhinomanometry, posterior test, and the acoustic rhinometry before surgery. Look, with attention business. It's no nose. No have the problem is because the hand part of the septum was broken, and this is the bony part is striped, and the cartilaginous part go in the right, because it go down the hand part of the
بس
septum.
هو ما كانش يبان خالص.
The same approach, like I show you, the magic play, meaning is this section, this section. And in this particular case, I make all four tunnels, dissect all septum, and finally extracorporeal septoplasty. I will explain in class the philosophy for this situation. I remove the scar in the medial crura, the tunnel, the schisto arrived until here. Why? Because I need to move the skin up. And in this moment, you see without the septum, the baby. The new septum, the piece right now. I introduce it inside, and this was the result after 1 year. No aesthetical surgery, but functional surgery, sorry. Why? Because it's deviated, now it's straight. In the lateral view, change this part. And look before and after. Now it is open the valve area in the left. And the pre-op analysis, post-op analysis. I will show the steps with the small video clip that show you 3 minutes, the technique, the technique that I use. Sorry. We look, the septum is down, the deviation in the left part. The 6-year-old child, hemitransfusion incision, go in this line. This is the protector to HeLa, because if the scissor go out, cut here, the dissection to the anterior tunnel in the left. Be careful and stay always under the perichondrium, because this helps you for the dissection, and you see don't have any bleeding in this time if you stay under the periosteum. Magic play, meaning it is open a space here in front, no cut, only this section, in front of the nasal spine, in the left, and the right, no cut. The tunnel inferior is this. The piriform crest, this helped me to go up the mucosa over the floor of the nasal cavity, and when I remove the septum, the mucosa is cut. The right septum dissection. Look, this is the Killian technique. I preserve always the nasal spine, and then the scissor started here. The superior chondrotomy and the osteotomy, I remove the piece of the perpendicular plane. And all extracorporeal septoplasty through one transfusion incision without opening the nostril. I'm painting, soft painting I remove after 2 days. The correction of the septum now. I prepare the new mosaicum, the new septum, a piece that I prepare for the intracolumnar structure through the transfusion incision. And the new septum here. The tunnel through the dorsum and the intracolumnar tunnel. And in this area, I will introduce a piece, a columnar structure, without opening the columella area. And fix immediately with this Dexon, this rascobable suture, no need to remove it. And now, introduce my piece inside. The septum, quadrangular cartridge, and why I make the packing before? Because when I insert the piece, this is with fixed in the mucosa. But the other behind the body stay behind without the shoot. But before I'm painting, then stay immediately part of the septum. And finally, the last suture in the septum. But to prevent the settling, I take the mucosa and no cartilage in this moment. Finally, the septum stay up, not go down, because the mucosa stay down. And to prevent the settling up the septum, fix it through the mucosa, and then this is, look at the case, 6 years old, before and after. Now it's satisfied. And you know the maturation, and this is no rhinoplasty.